I am deeply honored to welcome all of you to the second day of the 2021 Shared Value Leadership Summit. My name is Nikhil, Bumb, and I'm a director with FSG, which is a not-for-profit social impact consulting firm seeking to create equitable systems change. The Shared Value Initiative, which organized this week's event, sits within FSG and is a global platform for leaders seeking to address societal challenges with business solutions. For those who were able to join us yesterday, you heard about the role companies have to create change, to address the greatest social issues of our time, and about the significant opportunity companies have missed by not taking an explicit focus on equity. But through shared value and through an intentional focus on addressing the barriers preventing our most marginalized consumers, customers, and communities from accessing basic services and rights, we believe and have seen that companies have the potential to see tremendous economic and business value and growth. Yesterday's sessions focused on financial and economic inclusion. For those who missed yesterday, we encourage you to catch the recording where you can hear from leaders from PayPal and Unilever, as well as Darren Walker from the Ford Foundation, Mark Kramer, the founder of FSG, and Bobby Silton, the managing director of the Shared Value Initiative, among other fantastic leaders and speakers. Today, over the next 2 hours, we will hear from leaders based in all corners of the world about how they work within a global health ecosystem to equitably expand access to healthcare and create fair and just opportunities to achieve optimal health outcomes for all. At FSG, I have the humbling privilege of helping to lead our corporate racial equity practice. A significant portion of that work has included working with biopharmaceutical companies, medical technology companies, as well as consumer goods and retail companies on how they can advance health equity. In the US, that work comes with a recognition of how structural racism sits at a root cause of many of the health inequities faced by communities of color, but also when we look across other dimensions, including rural populations, low-income communities, and LGBTQIA+ populations, to name just a few of the intersectionalities. We also know that health equity is different in different contexts. As the son of 2 South Asian immigrants, whose family on both sides come from farmer communities in rural Northwest India, growing up as a brown man in the United States primarily in a post-September 11th context, and having lost relatives and close friends in both those settings due to inadequate access to health and quality healthcare, I can both personally and professionally attest that, irrespective of the company or the geographic setting, those of us doing this work know that to truly move the needle on access to health, we must not limit our focus to only the clinical settings, but also recognize and account for the underlying social and structural factors shaping health outcomes. Science has shown us that 90% of health happens outside of clinical settings. It is shaped by the social and structural determinants of health. Through our work at FSG and the Shared Value Initiative, working up close with companies on issues of health access, we have seen firsthand the challenges companies face. We also increasingly recognize that all companies, not just those traditionally in the healthcare and life science industries, have an opportunity to improve access to health. For example, by incentivizing healthier behavior with their employees and consumers, as we'll hear more about later today. While it may seem challenging to address these social and structural factors as we consider how to improve access to health, there are also significant opportunities and competitive advantages to doing so. By working to address barriers to care and barriers to health, and in doing so, creating a fair and just environment for all to access health, companies can fuel incredible innovation and advance scientific and technological frontiers. They can also expand markets and increase their revenue share and growth while increasing their access to capital and talent, all while creating better outcomes for patients and communities. Today, we're excited to share with you a series of speakers who will provide examples of the ways they are exploring how to improve access to health and create equitable outcomes for all. As we'll hear in the next 2 hours, organizations around the world are committed to addressing health inequities. We'll hear what is possible, lessons and learnings along the way, and how to inspire more action to drive more scale sustainably. You'll hear from Merck and LifeBank, who are bringing life-changing supplies and medicines to resource-limited settings. A conversation with the Rockefeller Foundation and Abbott about the role of data and technology in delivering more equitable health outcomes. We'll hear from Procter & Gamble about changing harmful narratives, particularly in the context of women's health equity, and from Discovery on incentivizing healthier behavior and linking healthcare to financial well-being and climate impact.